And with all your permission, we are beginning with the session for today. Good afternoon, everyone. This is Batul from IGCP, the moderator for today's session, and I would like to welcome everyone wholeheartedly at our platform for the better exchange of knowledge that is going to be shared by one of our renowned neurologists, who is none other than Dr. Suchit Tamboli, sir. Sir is PhD in Developmental Pediatrics, FIAP, MBBS, DCH, PGDAP, PGDMLS, Consultant Development and Behavioral Pediatrician at Chiranjeev Clinic. Sir is the founder and director of First Child Development Center in Maharashtra since 1992. Sir is also the national chairperson at IAP Growth Development and Behavioral Pediatrics Chapter 2014215, Central IAP EB member of 2079 to 2019. With Sir's wonderful insights, we are going to talk about the topic for today, which is understanding autism. And to talk about this topic, we will be moving on. Before moving on, we'll be having a short description about the topic. In this webinar, we'll be enlightening about the autism, designed to provide valuable insights in the complexities of autism spectrum disorder. Whether you are a parent, educator, healthcare professional, or simply interested in learning more about autism, this session will equip you with the knowledge and tools to better understand and support individuals with ASD. So now, without any further delay, I would like to welcome Sir at our forum and would like to hand over the session to him for his precious talk to begin. So over to you.
Okay, thank you very much. At the outset, I must thank IJCP for giving this opportunity. And now we will start our session of understanding autism. Actually, autism means always unique, totally interesting, and sometimes mysterious. So that is the full form of autism, which we usually tell to the parents. So we will take one case who came to me, Rahul, who was a 2 years old boy. His parents have previously brought him to my clinic for immunizations only, and they are now concerned that he is not talking. So he was born to healthy parents after a normal pregnancy and delivery. His physical growth and motor skills have been age appropriate. Rahul now makes less eye contact, seems less interested in interacting with his family. He is not interested in playing pretended games. He loves watching videos, particularly one cassette, which he insists on watching several times a day. He has several tantrums, particularly if his daily routine is altered in any way. His physical examination is completely normal. Then another case, Ali, that mother was telling that my son is 3 years old. He is very hyperactive. He can talk but won't reply to my questions. He only listens to me when he is in a mood. My daughter was more mature at this age. So his father and uncle both talk late. Should I be worried? My friend's son has improved a lot after speech therapy. So should I see a speech therapist? So will the speech therapist will teach my child to talk? Actually, there is another case, Dhruva. He is again 3 years old and he is hyperactive. Last 6 months, he has started going to play school. Just wouldn't sit in a classroom. We went to see a psychologist at the request of the school. After assessing my son, she said he has autism. What does that mean? She says he needs therapy. What does that involve? Will he become normal? She also asked us to see another doctor who would give him medicine to control his hyperactivity. So, all are these medicines safe? Will it harm his brain? So, all these three cases are very prototype cases where we should know that this what is autism we should understand, because these cases we are going to discuss uh, very deep. So it is very unique in nature. Why autism we should know? Because it is very unique in nature. Because you cannot see you can identify Down syndrome, you can identify mental retardation, but autism child looks normal. So you cannot identify that by looking into the face of the child. So it is very unique in nature, because an apparently normal looking child with so many abilities and skills is not functioning in a social setting. That is more important. That whenever the mother says that the child is not functioning in social setting is very important. So when assessed on developmental scale, they show total lack of uniformity in different areas of development. These children have to be diagnosed on the basis of clinical suspicion and assessed by using autism specific scales. So, developmental disorder characterized by qualitative impairment in reciprocal social interaction and social communication, and restrictive, repetitive, and stereotype pattern of behavior, interest, and activities. So, they may have an unusual response to sensory experiences or perceptions. So, what is the prevalence? It is 1% of the population. So, nowadays, the every one child in 69 children in India is autistic. It is very alarming. Means when I started my practice 32 years back, we used to see autism very rarely, but now it is very common disorder. The prevalence has doubled in last decade. So recent estimate of prevalence of ASD in US in the range of 6.6 per thousand. So more boys than girls are consistently found to be affected with the autism spectrum disorder, with male to female ratio ranging from 2 is to 1 to 6.5 is to 1. Common age of presentation is 1.5 to 3 years, which is very important because if you cannot identify it early, then there will be a problem. So you must diagnose it and suspect it early. So what is etiopathogenesis? We do not know what causes it. बिकॉज मेनी टाइम्स अरे हमारा बहुत झगड़ा होता था इसलिए ये हुआ क्या, मैंने प्रेगनेंसी में कम खाना खाया था उसकी वजह से हुआ क्या. तो एक्चुअली वी डोंट नो द कॉज. Current research indicates that anything that can produce structural or functional damage to the central nervous system can also produce condition of autism. There are certain viruses which has been blamed or it has been said that it is a known genetic condition. Only 10% cases it is genetically transmitted. Families that have more than one child with autism, again there can be a suspect in second child also. So caused by different factors. The cause is never known. Autism is not caused by an unhappy home environment. It is also not caused by both parents working, mental stress during pregnancy, poor handling by mother, emotional trauma, or other social psychological factors. So you cannot cause a child to become autistic. That is very important sentence. So you cannot cause a child to become autistic. So, if you see the genetics, ASD has in fact become a model for both the benefit and challenges of complex trait. That is, trait which is not caused by inheritance of the single gene. So, autism is known from twin studies to have heritability as high as 90% or as little as 40%, meaning 40 to 90% of variation in autistic trait in a studied population is due to genetics. So 15% or more of autistic spectrum disorder cases are caused by de novo mutation. Advanced parental age and maternal age appears to be risk factor for the ASD. But what is important? It is important that you should label. Actually, labeling is not very important, but to enabling is very important. So, labeling to enabling, what we should do. Diagnostic to multidisciplinary early intervention is very, very important. So, what is the triad of impairment in autism? In the language and communication, it is impaired and deviant language and communication, verbal and non-verbal, both are affected. Social, impaired, deviant, and extremely delayed social development, restricted, repetitive, and stereotype pattern of behavior, interest, and activities. Then, many times, what happened that parents usually come to you as a that my child was apparently normal till 1 year of age. He was saying Mama, Dada, Baba, but now he has forgot. So, what is the regression, which can be between 12 to 18 months? So, regression can be in a language around 41%, in social 37%, and play 9.8%. So actually here, what is important, we should, if you see the race car, where important is that whether it is a normal development, slow development, or deviant development, or slow and deviant development. So that is important. So last fourth is slow and deviant, delay and deviance. So um third is delay, second is normal, and deviance is again on the top. So we should know what is difference between normal development, slow development, deviant development, and slow and deviant development. So what are the clinical features of autistic spectrum disorder? It manifests vary with the age and degree of impairment. Onset usually before 3 years of age. Impaired ability to develop normal social skill with lack of eye contact, gestures, and facial expression. So often do not engage in pretend play, which starts before the age of 2. So delay in or failure to acquire speech. Young children with autism also have deficient comprehension and the communicative use of speech and gesture, and intrusive stereotype and sensory experiences. So what are the early red flag signs for communication? The child who do not babble by 1 year, does not point to object or people by 1 year, does not make meaningful gesture by 1 year, do not speak one word by 16 months, do not combine two words by 2 years. So these are important early red flag signs for the communication. Then again, speech which is not understandable by 24 months, does not respond to name, loss of language or low social skill at any age, then decreased use of non-verbal behavior during communication, such as eye-to-eye gaze or facial expression, body posture or gesture. Then, what are the early red flag signs for the social functioning? Social functioning, there is poor eye contact, doesn't smile in reciprocation, doesn't seem to know how to play with the toys, excessively lines up the toys or object, it is attached to one particular part of the toy or object, शाल लेके बैठा है, शॉल लेके बैठा है, या टॉय टॉय को लेके बैठा है, वो छोड़ता ही नहीं है. Absence of joint attention, doesn't share enjoyment, interest or achievement with the other people. So then other red flag like decreased interaction with the peer or friends, doesn't play with the toys appropriately. ये इनको टॉय के बजाय चीजें ज्यादा लगती है, जैसे कि अभी किचन में जो यूटेंसिल्स रहते हैं उसके साथ वो ज्यादा खेलते हैं. तो फिक्स पैटर्न ऑफ इंटरेस्ट और एक्टिविटीज, lines things up, old movement pattern and or repetitive behavior, demonstrated echolalia. So I want, so they have echolalia, repeat the word, they are hyperactive. So children at higher risk, that is sibling of children with the ASD, then there is 10 times higher risk. Comorbid genetic syndrome like Fragile X syndrome, tuberous sclerosis, chance of getting autism is more. Prenatal exposure, valproic acid or rubella, presentation, regression in milestone around 25 to 30%, 15 to 24 months of age, that is verbal children diagnosed late, change or delay in language, social awareness or behavior. So most important test for autism screening is MChat, which is nowadays used in all over world. We have a Hindi, Marathi version of MChat also. Here, what is done is whenever the child is visiting routinely and you suspect that this child may have autism, then this questionnaire can be given to the mother, and it should be given for the babies who are 16 to 30 months of age. There are 20 questions. It requires less than 10 minutes to solve. Score if more than 8, then you must refer that child. Score less than 3 is pass, and 3 to 8 use detailed follow-up tools. So that child needs again repeat MChat after say 3 months. It is available in Hindi, Tamil, Bengali, Punjabi, also in Marathi. Then look at what you call pretend play. Pretend play is again very important for these children. They don't like pretend play. कि गुड़िया को नहलाऊं, गुड़िया का मुंह पोछूं, ऐसे कुछ वो करते नहीं. So climbing on things, point with one finger to ask for something, point with one finger to show something, interested in another children, show your things. ये actually response to being here. Important thing is that उनको ऐसे लगता है कि ये चीज को ऐसे उंगली से नहीं बताते वो, तो वो उनको लेके जाते हैं वहां पे और फिर बताते हैं. So that is very common. So actually you must see that whether your child is deaf or not, because many times what happens that parents tell us that ये कभी कभी सुनता है, कभी सुनता ही नहीं है. तो ये सुनाई देता है या उसको समझता नहीं है, वो नहीं समझता. So you must do Bera test to rule out deafness also. Unusual finger movements, upset by everyday noises, likely to be autism. So play and thought and behavior. So doesn't know how to play with the toys, casting, throwing, banging of toys, lack of pretend play. Then spends lot of time stacking objects, lining things up, putting things in a certain order, shows unusual attachment to the object or schedule, and hypermetropic or overactive children running around all the time. So imaginative play, these children usually do not have that imagination, copies pretend play or like that. Then related problems like sensory issues, usually present but not essential for the diagnosing autism. So tactile, that is walks on his toes or mouthing, leaking object, lack of pen, auditory, then hands cover the ears, olfactory, sniffing, visual, lights, looks at odd angles, gustatory, extreme food selectivity, and vestibular is jumping and circling. So it is important that sensory issues also should be diagnosed earlier, so that we can diagnose that earlier. So range of symptoms. A person might have average intelligence, have little interest in other people, use limited verbal language, experience intense self-stimulatory behavior such as hand flapping or underreact to the pain. So that is again very common symptoms which you can see in autism patients. So overreact to sound. कुकर की शिट्टी बजती है तो भी वो कान पे हाथ डालते हैं. Very good gross motor skill, weakness in fine motor skill. The symptoms may vary widely from person to person. So social skill, actually social issues are one of the most common symptoms of all types of autism spectrum disorder. And people with ASD do not have just social difficulties like shyness. The social issues they have cause serious problems in the everyday life. So doesn't respond to name by 12 months of age, avoids eye contact, prefers to play alone, doesn't share interest with others, doesn't only interact to achieve a desired goal, and has a flat or inappropriate facial expression. Then does not understand personal space boundaries, avoids or resists physical contact, is not comforted by other during stress, has trouble understanding other people's feelings or talking about other people's feelings. Typical toddler also show interest in the social games like peekaboo or patake, but a young child with an ASD might have a very hard time learning to interact with other people. Some people with ASD might not be interested in other people at all. So other might want friends but not understand how to develop friendship. So many children with ASD have a very hard time learning to take turn and share much more than other children. So this can make other children not want to play with them. So they have that in mind. So they will not play with them. So people with ASD might have problem with the showing or talking about their feelings. So they might also have trouble understanding other people's feelings. Many people with ASD are very sensitive to being touched and might not want to be held or cuddled. Then self-stimulatory behavior. This is again very important. Flapping arms over and over are common among people with ASD. Anxiety and depression also affect some people with ASD. All these symptoms can make other social problems even harder to manage. So for communication, around 40% of children with ASD do not talk at all. That is very important and alarming, that you must understand that 40% of the children with autism does not talk at all. Each person with ASD has different communication skills. Some people can speak well, others cannot speak at all or only very little. About 25 to 30% of children with ASD have some words at 12 to 18 months of age, and then they lose them. Others might speak, but not until in the later childhood. So delayed speech and delayed language, repeat words or phrases, that is echolalia, reverse pronunciation, does not point, no gestures. This is very important, that they don't point out the object, but they will take the parent to that object. So gives unrelated answer to questions or use few or no gestures. Talk in flat, robot-like or sing-song voice. मुझे रोटी चाहिए. So does not pretend in play. So does not pretend to feed the doll or other which I have told. Does not understand jokes, sarcasm or teasing. People with ASD who do speak might use language in usual ways. They might be able to put words into real sentence. Some people with ASD may only one word at a time. Others repeat the same words or phrases over and over again. This is very common कि मुझे स्टडी करनी है, मुझे पढ़ाई करनी है, मुझे पढ़ाई करनी है, मुझे पढ़ाई करनी है, ऐसे बोलते तो रहते. Some children repeat with the others. The condition is called echolalia. I have already told you about that. And repeat that they hear it normally passes by 3 years of age. Hard time using and understanding gesture, body language, or tone of the voice. For example, people with ASD might not understand what it means to goodbye, wave goodbye. So facial expression, movements, and gesture were not, do not match what they are saying. So, for instance, people with ASD might smile while saying something sad, so which is again common. People with ASD might say I when they mean you or vice versa. These children stand too close to the person they are talking to or might stick with one topic of conversation for too long. Some people with ASD can speak well but might not have hard time listening to what other people say. So they might talk a lot about something they really like rather than have a back and forth conversation with someone. Some children with fairly good language skills speaks like adults. Some children with fairly good language skills speak like little adults and failing to pick up on the kid speak, which is common with the other children. So interest or behavior, where unusual interest and behavior related to ASD, they line up object, plays with the toys with the same way every time. Means if you change the way, they will very annoyed. So an unusual interest like parts of objects, it is very organized, gets upset by minor changes, has obsessive interest. So here They are organized and they want same thing, same place, same time. So like that. So they have obsessive interest, has to follow certain routine, flapping hand or rocking body or spin self in the circle. So repetitive motions are actions which are repeated over and over again, and they can involve one part of the body or the either body or even an object or toy. Repeated flapping, already we have told, repeated turn a light and spin wheels spun pilot. Unusual interest and behavior, change in normal pattern of the day, like a stop on the way home from school, can be very upsetting to people with ASD. They might lose control and have a meltdown or tantrum, especially if it is in the strange place. So such people with an ASD also may develop routines that might seem unusual or unnecessary. For example, person might try to look in every window he or she walks by building, or might awaits want to watch a video for bringing to end, including the previews and credits. So not being allowed to do these types of routine might cause severe frustration and tantrum. Then are other symptoms like hyperactivity, impulsivity, short span, aggression, causing self-injury, unusual eating, unusual mood behavior, lack of fear, unusual reaction to the way to sound, smell, taste, abnormal eating habits, eat non-food items like dirt or rocks is again very common. They might also have chronic constipation or chronic diarrhea. So development different rate in different areas. Delay in language, social learning skill, while ability to walk and move around are about the same as other children. So they might be very good at putting puzzles together or solving computer problems, but they might have trouble with the social activities like talking or making friends. They learn hard skill before they learn an easy one and develop at their own pace. And age-specific developmental milestones are very important to measure the children's social, emotional, and emotional progress in the first few years of life. So there are some misconceptions about autism. That is, autism in autism, absent or no eye contact, but actually look at or through you, but eye contact has no social purpose. Are not affectionate. They are affectionate on their own terms, may even be clingy. Do not talk. Can use different words, usually by imitation. No treatment is available. Yes, treatment for the intensive intervention, if you give, then definitely there will be change. So no treatment available is false. Children grow out of it. Autism is a lifetime diagnosis. So children doesn't grow out of it. Assessing children, medical assessment, developmental assessment, assessment for autism, assessment of functioning of the child, that is level of the child. So medical assessment, history from the parents, so that is the role of the pediatrician. Events around the birth, family history, then medical illness, physical examination, which is usually normal, developmental screening. So hearing test might be done. Head circumference is very important. Dysmorphic features आहेत की नाही ते बघायचं. Neurocutaneous marker, neurological examination, vision and hearing. Usually large head is a problem. When present with the syndromic condition like Fragile X, Down syndrome, tuberous sclerosis, hypotonia may be present. So investigation, there are no specific investigation for autism, but 90% of the cases there is no identifiable cause. and no prenatal or carrier state diagnostic test which is seen. So hearing evaluation mandatory in all cases of speech delay. So medical workup should be done, like karyotyping, fragile X syndrome, fish characteristics. So you have to look for the either genetic testing, metabolic testing, or neuroimaging. So all these tests should be done for the routine of the uh, yeah. So differential diagnosis, ASD is sometimes mistaken for ADHD or ADD, conduct problems, hearing impairment, language disorder, mental retardation, visual impairment. However, these may exist as a comorbid condition also. So you can confuse between them, or you can be associated features. So, comorbid conditions like psychiatric disorders, intellectual disabilities, epilepsy, seizure, feeding disturbances, sleep disturbances, hearing impairment, and assessing the child with ASD. So, here most important is medical assessment by history and examination, then developmental assessment by doing DQ by Bailey scale or like that, assessment for ASD like CARS, DSM-5, ADIR or ADOS, assessment of functioning of the child. So strengths and difficulties. This is very important from the treatment point of view, because nowadays WHO and UNICEF says that you should assess the strengths and difficulties, and then tell the parents that your child strength is in this area and there are difficulties in this area, but we will actually allow the child to exceed from due to his strengths. So that is very important. So how we can use that strengths and difficulties can be converted into the uh, chance, or the strengths, that is very important. So diagnosis, it is a clinical diagnosis. Children have to meet certain criteria which are based on developmental and behavioral characteristics before we can give them a diagnosis of autism. There are no specific investigation for autism. Investigation should be directed towards associated medical disorder and based on clinical suspicion only. So 10 to 40% cases of ASD have an identifiable medical disorder, and remaining cases of autism there is no identifiable cause. Inheritance is likely to be multifactorial, and current research available gives familial empirical recurrence risk. So there are no prenatal or carrier state diagnostic tests. Then one important test is DSM-5. Here there is actually the child must meet criteria A, B, C, and D. So here persistent deficit in social communication and social interaction across the context, not accounted for by the general developmental delay and manifest by 3 years of following. Three of them are following, not 3 years, sorry. So deficit in emotional and social reciprocity, deficit in non-verbal communicative behavior, and deficit in developing and maintaining relationship. These are very important. Then restricted repetitive behavior pattern, at least two of the following, that is repetitive speech, adherence to the routine or ritualized pattern of verbal or non-verbal behavior, then fixed interest that are abnormal in intensity or focus, and hyper or hyporeactivity to the sensory input or unusual interest in the sensory aspect of the environment. Then symptoms may be present in early childhood but may not become fully manifest until the social demand exceeds limited capacities. This is the reason why children present late, that is not at birth, but it is usually around 1.5 years to 2 years. So symptoms, they must be present in early childhood. Symptoms together limit and impair everyday functioning. So that also should be noted. And specify if with or without intellectual impairment is there or not. एक्चुअली माय नेम इज खान पिक्चर में जो एस्पर्गर सिंड्रोम दिखाया है कि वो ऑटिज्म स्पेक्ट्रम में आता था पहले, अभी निकाल दिया है, तो वो वैसे with intellectual disability is there or impairment is there or not, you should answer that one. Then associated with the known medical genetic condition, any comorbid condition, that also you must specify. So then severity. So we have to identify that whether this child requires support or requires substantial support or very substantial support. So according to that, you can give the label to the child. Then what is ideal approach for the treatment? Team effort of the parents, teachers, doctors, therapists, medication, behavior modification, and regular monitoring. So actually, ASD, similar to other neurodevelopmental disabilities, needs supportive and continuing management. So medication have not been proven to correct the core deficit of ASD. So important is medical management, educational intervention, and complementary or alternative medication. So to maximize the child's functional independence and improve quality of life, facilitating development and learning, promoting socialization, reducing maladaptive behavior, and educating and supportive family. So actually, supportive family plays very important role, providing information about autism to them and making them as a resource, and parents training in behavior management, sensitizing teachers and caregivers, support to sibling and extended family. Then what are the primary goal? To maximize the child's functional independence, that is ADL, and improve quality of life, facilitating development and learning, promoting socialization, reducing maladaptive behavior, and educating and supporting families. So educating and supporting family means providing information about autism, parents training should be done, sensitizing teachers and caregivers, and support to sibling and extended family. So recommended mode of management, behavior and emotional, actually communication based approach. This can be coupled with the parental training and family support, occupational therapy and sensory integration therapy. Actually, we didn't got any occupational therapists for 28 years, but now since last 2 3 years we have got very good occupational therapy. So then, with management of activities of daily living and sensory issues, speech and language therapy to improve the communication, and medical management include all immunization, treatment of acute illness, management of sleep dysfunction associated with the medical problems such as seizure or GI disturbances, constipation, and then treating coexisting challenging behavior or psychiatric condition. Prognosis depends upon the severity, pattern of onset, and clinical course, cognitive abilities, associated condition, then importance of early diagnosis, and need for the sustained support. So to summarize, primary physician or teacher usually suspect first. So they suspect first autism, then impairment in social interaction and communication with restrictive, repetitive pattern of activity or behavior. It is a clinical diagnosis, so investigation have limited role. Then use MChat, which usually it is very important for 16 months to 30 months children, for screening of the child. And earlier you intervene, better is the outcome. Refer it early. DSM-5 is the current standard for the diagnosis. So these are some books, these are some websites. So thank you very much. Uh, Thank you.
Thank you so much, sir. Thank you for your enlightful talk that you have shared on our platform and for making our viewers understand about the topic in such a better manner. Thank you so much for that. We have received few questions from the participants. So, with all your due permission, I would like to put across those questions to you.
Yes, yes, always.
Yeah, so the first question is related to ethical considerations. What
Yeah.
ethical considerations should healthcare providers keep in mind when discussing the diagnosis and treatment options with families of individuals with ASD?
Yeah. It is very important that actually whenever you are going to diagnose the or telling the diagnosis to the parents, you should have proper scientific report to actually convey your feelings, because मुझे लगता है ये ऑटिज्म है, ये सेंटेंस एक्चुअली पेरेंट्स के लिए बहुत हार्मफुल है, क्योंकि अगर आप बोलेंगे कि पेरेंट्स के लिए कि ऑटिज्म है करके, तो वो पहले जाके गूगल करेंगे, देखेंगे, फिर ये करेंगे, और अगर ऑटिज्म नहीं निकला तो देन दे विल sue you in the court of law. So that's why you must say that there are these tests suggest that this is autism, and then we will again repeat it after a few months. We have to start the treatment, and ethically, which is very important, is that earlier the better. So you start early intervention, which is very important. Without not my aim is that not to label your child, but to enable your child. So you have some deficit, you have some problems, so that problems will be taken care of with the treatment. So treatment can be in the form of speech therapy, in the form of occupational therapy, in the form of stimulation programs, toy stimulation program. So all these are very important. Okay.
Thank you
Next.
so much, sir. Thank you for answering that question. We will move to the next question. And the
Yeah.
next question is related to the sensory processing issues. So, how do sensory processing issues manifest in individuals with ASD, and how can these be assessed during the diagnostic process?
Yeah, actually, sensory uh, problems are there. Like what I had told, that the child may not listen to the big noise, or child may not have that sensation regarding the soft and hard, or like that. So here, most important role is of the occupational therapist role. So sensory integration therapy is the mainstay therapy for the autism, and that's why we should actually involve sensory integration part of the autism. This occupational therapist for these children.
Thank you so much, sir. Thank you for making us understand about this. Moving to the next question, and the next question is related to current evidence based treatment. So, what are the current evidence based treatment options for managing core symptoms of ASD?
Yeah, actually, core symptoms of ASD you cannot give cure for them. That is very important, and that you should clear it with the parents. That what we are going to do is that we will decrease the like child is hyperactive, then you have to give medicinal management as well as uh, occupational therapy and other therapy. So keep that child engaged. How we can keep that engaged? How we can do that? That is to be told by the stimulation program therapist. Then occupational therapist also will do some work regarding the this thing. That child should be taken care by proper sensory integration methods should be given, that hyperactivity will be reduced, and with the medicine as well as with the therapy we can manage the child. But remember that autism is not curable disease. You can decrease symptoms. Yes, autism is reversible in few cases, like pseudo autism. Like nowadays, we are getting many patients with mobile addiction, and with that mobile addiction, we usually ask the parents that how much time you give mobile to your child. So they tell that okay, we give during their when they are eating, so 3 4 times a day, and then other time. So it total comes to around 4 hours or 6 hours. Then television again for 1 hour or 2 hours. So all these are very important, and you should avoid that and actually stop that. What is the recommendation by IIP as well as UNICEF and WHO is that up to 2.5 years there is no mobile. So whenever we diagnose autism from 1.5 years to 3 years of age, that time we should advise them not to use any media. Only actually video calls are allowed for them. All other are not allowed at all. And they say that अरे वो मोबाइल का बटन अच्छा ये करता है, ऑन करता है, ये करता है। उसको समझता नहीं है ना, उसको आवाज आता है, उसको पैसिव मिलता है, इसलिए वो करता है। So you please stop all media as well as mobile below 3 years of age. That is very important. And then other therapies which are there, which are occupational therapy or speech therapy or stimulation program. How we can give stimulation program? So actually, we assess the child in 6 areas, like gross motor development, fine motor development, then mental development, then social development, expressive language, and receptive language. So if suppose child is 3 years old, but in expressive and receptive language, child may be 11 months old, or in gross motor, it might be 2.5 years old. So there are different areas and different problems. So that should be taken care, and you should start where he understands. So उसको कहाँ से आता है वहां से शुरू करो. Then you will definitely get good result. Yes, ma'am.
Thank you so much, sir. Thank you for answering that question and all the other questions for our viewers and for making them understand about the topic in such a better manner and for making them aware of the topic. I hope that this is definitely going to help them in their clinical practice. So, thank you so much for that. And with this, we would like to conclude the session here for today. Until next time, with all your last concluding remarks, sir. So, any last concluding take home
Thank you
message
very
from
much.
your end?
Yeah, take home message is that, see, most important is that uh, आप सिर्फ एक्चुअली 4 बातें देखना जरूरी है कि 2 2 महीने का बच्चा है, मम्मी की तरफ हंसता है कि नहीं, सो सोशल स्माइल। 4 महीने का बच्चा है, वो गर्दन पकड़ता है कि नहीं, नेक होल्डिंग। 8 महीने का बच्चा है, वो बैठता है कि नहीं। 1 साल का बच्चा है, वो खड़ा रहता है कि नहीं, दादा मामा बाबा बोलता है कि नहीं, और उसका उसको अपना बोलना समझता है कि नहीं। ये पहले इंपॉर्टेंट है, इसको डेवलपमेंट ऑब्जर्वेशन कार्ड बोलते हैं डॉक्टर एमपीसी नायर का, और ये सबसे जरूरी बात है डेवलपमेंटल असेसमेंट के लिए। एनी मदर कैन एक्चुअली डू दैट। और अगर ये नहीं होता है तो अरे कुछ नहीं होता है, उसने गर्दन लेट पकड़ा था, वो लेट बोला था, उसके ऊपर विश्वास मत रखो जो दादी बोलती है, नानी बोलती है। लेकिन एक और जरूरी बात मैं टेक होम मैसेज में देना चाहता हूँ कि if the child has delayed in the speech, you should not actually keep it at home. Go to the doctor, give MChat, do detailed testing, and if it is not autism, it's always good. But if it is autism, then you start early intervention. So at 1.5 years, if you start early intervention, then you will get very good result. That is definitely there. So thank you very much for the patient listening and giving me this chance. Thank you.
Thank you so much, sir. Thank you for your valuable time and for being here at our platform. Thank you so much. With this, we are
Okay.
concluding the session here for today.